Hello again, everyone, and welcome back to Reddit Aliens. I'm John, and as always, thank you so much for being here. Good topic? Let's do it. People who work in hospitals, what's the most insane thing you've ever seen? Please remember to like, share, and subscribe.
A 20-year-old put his sport bike into the guardrail at high speed. He arrived alive and ultimately survived with his left arm, left leg, and right leg completely severed from his body. I just formalized all 3 amputations and surgery for hemostasis and skin coverage. The runner-up was a girl in her 30s with a locking blade knife that was stabbed through the left temple all the way to the hilt, with the blade crossing through her sinuses to the other side of her face. She was completely fine, and we removed the knife with no significant problems resulting. I was an 11 to 7 p.m. critical care supervisor in a 400-bed community hospital in Texas. Around 1981 or so, we had a rush admission from the oncology floor. A middle-aged lady with ovarian cancer and metastasis started to have vaginal hemorrhage. The ER physician on call for codes ordered her transferred while I tried to get a hold of her surgeon. He wouldn't return calls or attend to the patient. I got orders from the ER doctor for heavy pain medication and called the chief of surgery, who was there in 30 minutes. The RNs and aides were carrying basins of blood out of the room. Thankfully, she passed relatively peacefully. The surgeon was thrown off the staff when more neglect and poor treatment were revealed. Not the most insane, but certainly very shocking. A young man less than 25 tried to kill himself with a shotgun blast under his chin after his girlfriend died of cancer. He did not succeed, but what he lost was his jaw, his nose, his eyes, and part of his frontal lobe. I'm a physical therapist, and I was sent in to evaluate his discharge disposition. All his notes said he was GSW to head. It did not specify the damages. He had no face. It was just raw meat and exposed bone. They couldn't really dress it because it would get in the way of his breathing. He had something like 14 reconstructive surgeries planned. He lost his POA, and his mom pushed for all of his rehab and care. Guy went into his neighbor's garage and used a saw to cut his own leg off. He was with us for a couple of weeks. I asked him, "Why would you do that?" Soon after admission. He simply stated, "You can cut your hair or nails. Why can't I cut my leg off?" We can't argue with that logic. It wasn't until a few weeks later, when he was working with therapy and trying to manage transfers and daily living tasks, that he came to the realization, yeah, maybe I shouldn't have done that. I was a radiology assistant and handled a lot of images. Our office was remote, and we pulled and read for several dozen hospitals. A fellow nicknamed Jesus, he took an 80-foot swan dive off of a bridge onto railroad tracks. He was amazingly still conscious when they brought him in, and he was talking to everyone, flirting with the nurses and acting like he just woke up and was waiting on a cup of coffee. He broke dozens of bones, but had no other major trauma, not even a concussion. Piercings. There are lots and lots of piercings. They show up on x-rays. It's really weird when you see the name of someone you know pop up and see that, oh, they have a half pound of rings in their labia or penis. Child abuse. The worst was when you would see an image and know that this kid had been broken and beaten before because they had healed the old wounds. I spent more than one shift talking down an ER doctor so they could do their job when a child came in absolutely destroyed by their parents or caregivers. I have a couple that stick out. The first one I did not witness but was told about. The guy tried to kill himself by walking into a samurai sword. Wheeled into the OR with the sword still in and alive. He survived. A woman came in with an entire glass candle in her ass. She specifically asked for it back after having to have it surgically removed. Another gal with a bottle of fingernail polish in her ass. Her and her boyfriend wanted to try anal, and apparently a nail polish bottle was all they could think of to find her to loosen things up. You know those little gardening shovels with the foam handles? One of those handles in a man's ass. He claimed his wife did it to him to test if he was gay. A writing pen lodged into a 20-something-year-old's urethra. Ugh. He tried telling the doctor that he had swallowed it and it got stuck leaving his body. The doctor assured him that he was very well educated on the human body and that is not exactly how the body works or how it got there, LMAO. A woman had a toe amputation. She was diabetic and let a sore get out of hand. When they first unwrapped her foot, you could see the tendons on half of the top of her foot. I then witnessed the doctor grab her pinky toe with what we call a penetrative towel clamp, and he just tugged it off. Not even forcefully. It was so rotten that it just slid off her foot like butter. And last but not least, this poor elder gentleman who had flesh-eating bacteria around his entire anus. And after fighting it for a good year, there was so much scar tissue and what was rotting away. Ugh. Define insane. A critical care doctor is here. Insane? A late 20-year-old woman with about 35 kilograms, 120 centimeters, that's 77 pounds, or 4 feet, with multiple congenital abnormalities resulting in an inability to eat, talk, read, or understand, who had been that way since birth. She required total care for every bodily function and had for her entire life. She was in and out of the hospital monthly due to what was essentially unfixable body failure. Each time, we had to jam tubes in her, put her on various forms of life support, and repeatedly subject her to painful procedures while knowing all along that we could not and would not ever fix her in any kind of meaningful way. She was neurologically gone, yet her mother insisted she responded to her and expressed her feelings, insisting that we do everything. Ultimately, we had to put this poor soul through the pointlessness of prolonged CPR before she finally died. That was insane and cruel. One of the funniest was patient Allison Sleeper, now off the market, who thought he was a bear and roamed the halls half naked, growling and pooping his bowel preparation. He was captured in a female patient's closet. He suffered no injuries and didn't remember a thing. One of many stories from the night shift. A patient who was a one-on-one but acting okay suddenly ran out of his room and punched the back of a new NP's head, knocking her to the ground. She was young and in training, and her whole career was ruined due to the health complications from it. Another is an IV drug user taking off with an IV port. When we noticed he was missing, security saw footage of him walking off the campus 20 minutes prior. I had an admission on the medical floor. A man had been found at his home lying on the floor. Apparently he had suffered from a CVA, stroke, and had been on the floor for quite some time. The gentleman lived alone in a small house without neighbors nearby. He was eventually found, I'm unsure of who and how, and brought to the ED. Upon his ED visit, he was found to have developed decubitus, bed sores, to one of his hips and upper arm from where he had lain on the floor. There were maggots in the bed sores. Therapeutic Leech decided to make a run for freedom and somehow escaped the ICU room and made it across the hall before the nurse realized. I left a trail of blood all the way from the bedside out into across the hallway. Most disturbing, though, was probably a woman in trauma ICU after sustaining a traumatic brain injury when a tree fell onto her car while she was driving. The tree killed her teenage son, who was the passenger in her car. The TBI had severely impaired her short-term memory, which meant she kept waking up in the ICU, panicking, asking how her son was doing, and demanding to see him. So several times a day, this woman would learn anew that her son was dead. We had to ask the hospital ethics department if we should keep telling her he was dead. She was very insistent on seeing him if she was told he was alive, and force her to relive that pain over and over or lie to her repeatedly. It was horrendous. My wife was a nurse and used to work in an ER close to a major city. They had a lot of mental patients come through all the time. Usually these patients have someone who sits at their door and keeps an eye on them. The person fell asleep, so the patient tried to escape by climbing into the ceiling tiles. He made it further than you would think, and the security guard waited until the guy was right above him, punched his hand through a tile, grabbed the guy's ankle, and pulled him down through the ceiling. I always thought that sounded like something out of a movie.
Maybe he left some contraband in there or just was shy about open wounds. Ugh.
Not me, but my mom. I don't know if it's the most insane thing, but I feel like it's close. She used to be a nurse in a prison, and this one inmate kept banging his head on the toilet till he had a massive gash in his head. My mom said he was very sensitive, and anytime they touched something near it, he'd wince in pain, but later she saw him digging a finger in there, just feeling around. My co-resident intern year had an elderly man brought in by EMS for rapidly progressive bilateral leg weakness. The patient was the kind of person who hadn't seen a doctor in decades. A CT scan showed total occlusion of his abdominal aorta. The entire lower half of his body was dying. It was presumed he had an advanced malignancy that contributed to the hypercoagulable state, but by then, the cause didn't matter. Too much of his body hadn't been perfused properly for too long. The patient was calm throughout and seemed at peace with his impending death. He never even made it up to the floor. He died in the ER. Fortunately, they had called his son, who made it to the hospital to be with his dad when he passed. I didn't even know total occlusion of the abdominal aorta was possible. The fact that the guy had been walking until very recently and only called 911 because he couldn't walk anymore really blew my mind. Human body's crazy. This one time when I was working as a CNA, a doctor got two different patients confused. One had severe constipation and the other did not. He accidentally put in orders for an enema for the wrong patient. I go in there to assist, and as soon as we finish, shit shot so far out of her that it hit the window on the other side of the room. I'm talking about a constant stream with the force of 1,000 suns for about 15 seconds. We had to clear the room and call the cleaning crew to come sanitize, and as they were walking in, a poor man snapped and fell on the floor. I had to excuse myself and laugh for about 10 minutes in the bathroom after that. I didn't see this, but I was told this by a reliable source. A lady came into the ER convinced she was pregnant. Her belly was super swollen, and she said she felt the baby trying to move into her vagina. She had an ultrasound, and there was no baby. But there was a massive lump that turned out to be a 5-pound shit that was pressing into her vaginal canal. They actually weighed it after it was removed. Ugh. I was a patient in the mental wing of a hospital. Long story. I was there for 9 days, and I was literally the only sane person there. Anyway, 3 things I saw while I was there. The first was my roommate. He was around my age and relatively cognitive, but lacked common sense and seemed to have the capacity of a 6-year-old. In our room was a huge floor-to-ceiling cubby with 3 slots. He'd climb to the top cubby and belly flop himself onto the bed, a solid 9 feet or so. Very similar to the kid from Big Mom's house. The second was a Caucasian woman who was there because she jumped through a glass window. Her head was shaved bald, and she had stitches and staples all over her scalp. She was hissing and trying to bite at the techs. She was also yelling out, "Miller!" Lastly was a 700-pound woman who covered herself in some sort of shiny liquid, which I assumed to be soap because we were not allowed much. It was the middle of the night, and I heard the techs on the ward call some sort of code. I peeked out my door and saw said woman, naked as the day she was born, oiled up and slithering down the hall like a worm. Do you have beer? I have stories. Girlfriend 1 caught a guy with girlfriend 2. In the ensuing argument, he handed girlfriend 1 a sawed-off .22 rifle and said, "If you feel that way, shoot me." So she did. One shot pierced his stomach, severed his superior mesenteric A, cut through the aorta, and lodged in his spinal canal, without severing the cord. We had mast trousers back then, and one of our ER nurses was moonlighting as an EMT. He got his partner putting on and blowing up the mast. Mike put in 2 large bore lines and pushed in 4 liters of LR before the fast trip to our ER. The patient went to the OR within about 10 minutes of hitting our doors. He took 35 units of blood that night. The surgery went so long that by the time they had repaired the aorta and removed most of the vascularized stomach and all of his small intestine, his lower legs had been clamped off. So he had a BKA on one side and an AKA on the other. After a month in the hospital, having survived all of that plus ARDS, he signed out AMA with intra-abdominal drains still in place to go spend the holidays with girlfriend one up north. Thankfully, he never returned. I work in hospital pharmacy. I was on the obstetrics floor delivering medications for a patient when a guy walked by with a very pregnant wife in a hospital gown. Suddenly the guy starts yelling, "It's coming out!" I turned around and the baby had literally fallen out of her vagina. I turned toward the nurses station yelling for help when one of the nurses just came around the corner, told us to calm down, and just scooped up the baby and led the woman back into her room like nothing happened. Apparently the nurses thought it was hilarious that the large, bearded guy from the pharmacy was pale as a ghost and yelling for help. They still tease me. I'm not a nurse, but my son has had 35 shunt revisions from having hypocephalus due to being born with spina bifida. When he was 5, I noticed the scab on his head. He was sitting on his toilet chair, and I walked away for 2 seconds to grab something, and when I came back, he handed me the scab. I looked, and a pearl ball was looking back at me. I'm like squinting, and I'm like, that's not his skull. Oh my God, that's his shunt. So I calmly called the children's hospital and asked for the neurosurgeon on call. It's a resident. I told him what I saw, and I'm like, it's his shunt. He keeps asking me the color and what it looks like over and over. I'm like, sir, it looks like a pearl bowling ball, but mini. Sure as shit, my kid's shunt burrowed out of his head. That led to a full shunt replacement after being on EVD drains for 14 days to make sure he didn't get an infection. He's 24 now and has had 90 surgeries. I could go on, but this is the top 3 of the crazy shit. I wouldn't have survived him either without amazing nurses and doctors. Residents and fellows, I still side-eye and don't take their BS, but I've met more good ones than bad ones. I have a few, but I'll get to the collective insanity one out of the way first. Having to go from shuffling bodies in and out of overflowing morgue freezers, overflowing overflow morgue freezer, and overflowing autopsy freezer so they didn't rot before the funeral homes caught up during the second COVID wave, to dealing with COVID deniers, anti-mask morons at the hospital entrance screaming that COVID wasn't real. Back and forth, often with the same 5 minutes every shift. Those people had lost their minds, and I felt like I was about to lose, too, after dealing with them. A patient who had simultaneous medical and psych issues was stripping naked and ripping a Foley catheter. If you're not familiar, they have an inflatable balloon on the end inside the patient's bladder to keep it in place, out of his dick like he was starting a lawnmower, then standing there screaming with blood streaming out of his penis and pooling under his feet until we got in there and restrained him to a bed. One of my colleagues who went in with me had an armload of towels he was dumping on the blood so that we didn't slip while wrestling with him. While working in a forensic psych setting, a guy came in who, despite being previously pretty normal, had stabbed his friend's daughter to death with a pair of scissors in the middle of the night. He then proceeded to attack police, attack nurses at the hospital he was brought to for self-inflicted injuries, attack correctional staff at the jail, and attack nurses at the jail before he finally ended up with us. Despite being in a high-security room, he managed to roll up a paper plate from his meal and stick it down his throat to try to asphyxiate himself. We ended up having to do a room entry with a shield to stop the attempt and restrain him. On a couple of occasions, I came across cars that hadn't quite made it to the emergency entrance and had to pull out deathly gray OD victims to Narcan them. Or I found gunshot wound victims in the back seat and had to pick them up and run them into the trauma room. Getting a stat call to a locked dementia unit because staff had brought in a cake and 2 large kitchen knives and left them. A surprisingly younger dementia patient who was convinced the nurses were going to kill her to steal her organs could find them. She proceeded to chase them around the unit, double-fisting knives, and even slashed one of them between the shoulder blades before I got there and managed to get her to put it down. Having a man with severe alcohol withdrawal and a suspected head injury come in incoherent and shaking like a leaf. Even with half a dozen peace officers, EMS, and nurses holding him down, he was still moving too much to get an IV started, and the IM meds weren't touching him. I ended up having to lay across his legs while nurses drilled an IO line directly into his shin bone just to be able to put the medications in properly. I remember laying on his legs, looking up toward his head, and seeing eyes the exact same color as my son's looking back at me, clearly terrified and trying to say something but too messed up to be able to form coherent words. We had to chase a young woman through the hospital after she came out of anesthesia badly, ripped out her IVs, and ran screaming naked and bloody throughout the hallways until we caught up to her.